Hi everyone, I'm Jennifer Mitchell, and I will be giving my speech today on the career of nursing. Nursing is a very common profession in today's society. Many people decide to pursue a job in this field. Do you think you have what it takes to become a nurse? Is the rewarding feeling of saving a life worth all the blood and guts involved? Being a nurse is an admirable and rewarding profession that impacts the lives of others. In order to become a nurse, one must first obtain an education in nursing. You would start this process by finding a college that you plan to attend. You may choose option number 1, which is a 4-year university, which would consist of maintaining your bachelor's degree of science. Option number 2 would be a 2-year college where you could get your associate's degree in science. Or option number 3 would be choosing a program where you receive a certificate of diploma, such as the LPN program. Prior to applying to the nursing program, you must first take your prerequisite courses, which is your basics like English, math, and science. Then once you're accepted into the program itself, you will take the nursing related classes that you'll use to work towards your career. Each program requires a certain amount of hours that you must obtain, such as the classroom and the clinical hours. Clinical hours are when you go to the hospital or nursing home settings and perform the nursing duties. Upon graduating the nursing school, you're still not a nurse yet. You must take state boards in order to obtain a nursing license. State boards consist of a test called the NCLEX, and you must pass this test in order to get the license, and it's based off of content that you learned in nursing school. I have talked about the education requirements involved in the career of nursing. I will now discuss the responsibilities of being a nurse. Nurses have many responsibilities, and in those many responsibilities are legal responsibilities. Nurses must follow all protocols to keep a patient safe. Some examples of this would be giving the correct medications, ensuring that the patient is monitored at all times, and following all the guidelines and nursing protocols involved. Nurses must also practice ethically. This means you must do what is always best for the patient. But sometimes a nurse must use her own judgment in situations in order to maintain the patient's safety. A real-life example of this would be if a patient was crashing or going down, and the nurse applied the O2 and got the patient stable, airway open and everything, and then called the doctor to come in and do his orders. Her judgment would be doing what's best for the patient first, and then what's best for protocol. Now that I have covered the responsibilities, I will talk about caring and compassion. In order to become a nurse, one must possess the qualities of caring and compassion. This profession is a people-oriented profession. Therefore, a nurse should be a person that they consider a people person. You must show the patient that you care about their needs. Compassion is also needed in nursing, because if you do not have compassion, then you don't have what it takes to pursue this career. An example of an everyday experience where compassion is needed would be caring for a dying patient. You must also care about the outcome of your patients. You can't just walk in the room and hand out some pills and turn around and leave. You must assess your patient, meaning fully head to toe, assessing all their needs, both physical and mental, and follow their care by interacting with the patient themselves and also the other members of the disciplinary team, which would consist of the doctor, physical therapist, etc. Therefore, as you can tell, a nurse has many roles and responsibilities. They are known to be very compassionate and caring people. They are legally bound to provide necessary and ethical care to all patients. There are a lot of education requirements that you must obtain in order to become a nurse, such as general education diploma, and then of course going through the nursing program and passing the state boards. Although when you look past all of these hardships of nursing and just focus on that one life you may touch during your nursing career, it can be the most rewarding profession. So ask yourself if you have what it takes to become a nurse. Can you look past the blood and guts and take the hand of the next person's life that you will change?